Welcome back, Straight Talkers. Today I'm going to talk about the medication Lamictal so that you can be more informed when deciding whether or not to start this medication. Lamictal was actually first manufactured in the United Kingdom in 1991, and by 1994, it was approved in the United States. It's on the World Health Organization's list of essential medicines, and in 2018, it was the 68th most commonly prescribed medication in the United States, with more than 11 million prescriptions. It was initially first used to treat seizures, and because of this, it's sometimes called an anticonvulsant or an antiepileptic. However, in psychiatry, we use it to treat various mood disorders, and it's often referred to as a mood stabilizer. It's thought that Lamictal changes the concentration of the neurotransmitter glutamate in the brain, in addition to blocking sodium channels. In adults, Lamictal is FDA approved for the treatment of bipolar maintenance and seizures, and it's also FDA approved for the treatment of seizures in kids. It's used off-label as well and can treat several other conditions including bipolar depression, psychosis and schizophrenia, major depression, and neuropathic pain. Lamictal comes in tablets, and these tablets come in different forms. Some might be swallowed, some might be chewed, and others might be orally disintegrated. And depending on which version you're on, dosing is typically between once to twice per day, and the dose range is generally between 25 to 200 milligrams daily. When being used for the treatment of bipolar disorder and the patient isn't on any other medications that can affect the levels of Lamictal, we typically start by giving 25 milligrams daily for 2 weeks, then 50 milligrams daily for 2 weeks, then 100 milligrams daily for 1 week, and then 200 milligrams per day thereafter. And I cannot stress how important it is that you only increase the dose under the guidance of your treating physician, as increasing the dose too quickly puts someone at risk of developing a serious skin rash, which we'll definitely talk more about in just a little bit. Generally, if someone is taking this medication for acute mania, effects should be seen within 1 week, whereas it might take several weeks to months if being taken for mood stabilization. There are multiple side effects that can occur with this medication, with the top 5 reported in clinical trials being nausea, insomnia, somnolence, back pain, and fatigue. One of the more serious side effects that everyone who is taking this medication needs to know about is the potential risk for a life-threatening skin rash. And this condition is referred to as Stevens-Johnson syndrome. And this is thought to occur in 0.08% or 0.8 out of 1,000 adult patients receiving Lamictal as monotherapy, and 0.13% or 1.3 out of 1,000 adult patients receiving Lamictal as adjunct therapy. It's worth noting that around 7 to 10% of patients will experience a benign rash, so knowing the signs and symptoms of a serious rash is necessary, and these include painful, scaling, or blistering bumps, involvement of the face, palms, feet, or mucous membranes, systemic signs like fever, lymphadenopathy, malaise, pharyngitis, or muscle aches, and eosinophilia or elevated liver enzymes. If you develop any signs of a rash while being treated with Lamictal, please reach out to your physician immediately. The FDA recommends stopping Lamictal at the appearance of a rash or fever within the first 2 months of starting treatment. Other serious side effects to be aware of include multi-organ failure, blood dyscrasias, aseptic meningitis, and increased suicidal ideation and behavior. It's important to realize that taking multiple medications at the same time may cause one medication not to work as well, or lead to an increased likelihood of potential side effects. And for Lamictal in particular, one medication that we will always want to know if you're taking is valproate, also called Depakote, as taking both together can increase the risk of the serious skin rash. When someone is put on Lamictal, it's ultimately unknown exactly how long they will need to be on it for, because it's dependent on the condition being treated. So someone with bipolar disorder might need to take this medication for several years, while someone who is taking it for aggressive behaviors might only need to be on it for a few months until behavior therapy starts to work. So if someone is taking this medication for seizures, stopping the medication suddenly could lead to convulsions, while if they're taking it for bipolar disorder, rapid discontinuation could lead to manic episodes. Also, I cannot stress enough the importance of talking to your physician before restarting Lamictal if you were to miss a dose, given the risk of developing the serious skin rash. Generally, if you're off the medication for 5 or more days, your doctor will likely restart the medication at a starter dose, and then slowly work you back up to your target dose to help reduce the risk of developing the skin rash. Thank you for watching this video. Now head on over to the next one to find out more ways that you can live your best life.